Navigated laser therapy is a new era of retinal laser therapy because navigated laser therapy allows to do a comprehensive laser treatment including digital planning, imaging before treatment and an eye-tracked navigated retinal laser treatment which allows high precision and accuracy and safety.
The main advantage of the navigated laser is that it allows me to go much closer to the macula than I ever dared do due to the unsuppressible tiny little eye movements that the patients invariably do.
So one advantage of the Navilas system is that in one system you put together the imaging modalities and you can do a planning for the patients. If you are used to the system a little bit, planning is very easy and then treatment takes less time than conventional laser treatment, which is comfort for the patient and comfort for the treater as well. So you can do the planning of the treatment in a calm atmosphere and then during the treatment you can concentrate on the patient and do a fast treatment because everything else is already done. There is not very much to learn and in a very short time almost everybody who is able to do a laser treatment itself gets used to the system.
The main advantage of navigated laser is its enormous precision in effect placement.
For the patient there are advantages. One is that it takes less time than conventional laser treatment and sometimes you don't have to use a contact lens, which is very convenient for the patient too and takes them the fear from laser treatment in somehow. And at the first moment we were quite astonished, but very most of the patients said they had much less pain than with conventional laser treatment. We are a university hospital, we see a lot of patients having diabetic macular edema and we have many patients returning many times. From my point of view, anti-VEGF has brought great advances into treatment of diabetic macular edema. However, laser treatment is the only treatment which allows long-term stabilization so far.
Especially with diabetic retinopathy and diabetic macular edema, the injection burden is considerable. So these patients who already have the burden of daily multiple injections of insulin, of numerous other treatments for manifestations of diabetic disease, now 8 times a year have to comply with getting, quote-unquote, a needle into the eye, a treatment that still scares the normal patient, even if he has had it often enough.
So we did a pilot study together with our colleagues from the US where we investigated patients having anti-VEGF treatment in diabetic macular edema. Our study design was to give the patients first 3 intravitreal injections of anti-VEGF and then if the retina was flat enough to do an macular laser treatment with the Navilas system. And we now have a follow-up for about 1 year of these patients and we found out that a significant number of patients had a very much reduced need of anti-VEGF injections after this navigated treatment, after having had anti-VEGF. If you have flattened the retina with anti-VEGF and the retina is ready for a laser treatment, laser will be an important option for the future to reduce the burden of anti-VEGF injections and stabilize the macular edema for a long time. Another major complication of diabetic retinopathy is proliferative diabetic retinopathy. For these patients, it's very important to have a comprehensive pan-retinal laser treatment. During this laser treatment, the patients sometimes need 2,000 or 3,000 spots. Doing this with conventional laser is sometimes very hard because it takes a long time, it needs a lot of compliance of the patient and of the treater. Navilas offers a wide field imaging modality where you can view large areas of the retina in one image, and you are able to do a navigated panretinal pattern laser treatment, which allows very fast, convenient panretinal laser treatment where you can apply a large number of spots in quite a short time, with the advantage due to the navigation that you are always sure that you don't touch areas you already treated and be on a safe side. We feel that navigated laser is a great opportunity to offer our patients the best treatment available. As already said, there are several advantages compared to conventional laser: the high amount of precision, accuracy and comfort, and the ability to have a digital imaging of the patients, combine it with the treatment planning, and the planning allows you to have almost every data of the patient in one data set, and this is a great advantage in clinical practice as well as for research purposes.